have an extra set of hands, that would be wonderful. And also you want to position the wheelchair on the strong side of the patient, okay? That way they can support themselves with their stronger side and then rotate with their weaker side. Because she has COPD, we'll have the portable oxygen here for her. We'll put the bed.
Bed, and since she is on the antihypertensives and all she's taking lots of medication, we're going to dangle her legs, keep her orthostatic hypertension. So, and you've got right-sided weakness, right? So we're going to just put the wheelchair on the left side.
Correct.
So we're going to go ahead and have her move her legs over to the side of the bed
And have her do as much as possible herself, and we just assist her.
You're good. And your feet aren't quite touching the floor. So we're going to put the bed down a little bit. And then we're going to put the bed down. Just kidding. It doesn't go down any farther.
So then you put the hand down around, which is going to assist with the transferring.
And while she's doing this, I'll go ahead and discuss some things that maybe you could, some interventions for someone who's got a stroke. We want to take care of their self-esteem, obviously. Like she was saying, let them do everything that they can do themselves and help whatever they can. They're going to have a risk for impaired skin integrity, so we're going to want to rotate them. We're going to want to make sure they're shifting in the wheelchairs if they're sitting in the wheelchair all day, which they very likely are going to be. Also with their COPD, with ours particularly, keep them on the oxygen, keep their O2 sats up. The activity intolerance is a big one. We're going to do range of motion exercises every day. Put them do as much as they can in their own. Maybe walk them around the hallway, which is what we were doing with Tiffany's patient, which is what we're going to be demonstrating today, is how to help them gain muscle strength back. So, make sure the wheelchair is locked. Okay. Okay. Got an angle here. Come over here and see if I can help us here.
Okay. The best way to use a gait belt is to grab it on the back side. In that way, it helps you have a grip on the patient so that you don't lose grip and they fall and hurt themselves and you don't injure yourself. You're not putting as much of your back into it. You actually have something there to help you. So the easiest way to do it is to have them scoot to the front of the bed as far as they can until their feet touch the floor. And you can just assist them. And they stand up.
I'm going to rotate. Give her a little help because she's not so much completely weak as just one-sided weakness. And her problem is that mostly you can just get her up. She can move herself to the wheelchair, but aside from that, she's more than tight. We're going to get this belt off of her now. Actually, no. Okay, and we're going to go ahead and do the oxygen and help with the activity tolerance a little bit. Oxygen, you're obviously going to be a little better out. So we're going to actually just kind of pretend to put this on her face because I don't know where it's been. Alright, and this is probably where we go ahead and give her bed bath and get her dressed and everything, and which is what we're doing every morning. So now, after we've done all that, made her bed and everything, we're going to go ahead and get up, and we're going to practice walking around the room so she can, gradually gain her strength back. So, we're going to just pretend that we already got you up, so you're just going to stand up and get behind the wheelchair and pretend it's a walker.
Oxygen, so it doesn't.
Okay. So, protecting want to be sure that you can see them at all times in your peripheral vision. And you also want to make sure that you have a hand on the gait belt to help them stabilize so that if you fall, you can get used to the ground and minimize any injury to them or to you. All right, so we're going to take a step, and you're going to step with your strong leg. Slowly move your foot forward. Good. You're going to walk heel to toe. It's really important because a lot of times they don't have the strength to actually bring their feet up, so that's another thing that you can work on with them in bed when they're not walking. Okay.
I just got a severe headache. For no reason.
Okay, and your face looks a little droopy now as well.
Oh, look, you're on this side then. Oh my goodness, maybe we should,
Okay.
grab you to ease your fall to the
All
ground.
right, so-
Your fall to the ground. Your fall to the ground.
So I have the gait
Your
belt,
fall to the ground.
and I'm easing her down onto the floor.
Okay, very important, which I told you earlier. We are going to call 911 right now because we're a long-term facility. We need to get her to the hospital. She's exhibiting signs of stroke again. Maybe she hasn't been taking her medication like a bad person. She needs to go to the hospital so they can, fix the blood clot. Maybe they can give her some, I don't know, there's a medication out there. Dissolves the clot quickly. TPA. Yeah, the TPA. It'll dissolve the clot quickly if it's an ischemic stroke. And if it's a hemorrhagic stroke, there's really not a whole lot they can do. They can try to control the bleeding. They can try to control the bleeding and, signs and symptoms, but aside from that, there's not a lot they can do. So we're going to hope she has an ischemic stroke and fix her up. So, I guess to conclude,
Well, another thing that you can do when you're walking a patient with weakness as well is you can have somebody follow you with a wheelchair in case something like that does happen and they need to sit down right away. Instead of easing them to the floor so that they don't hurt themselves, you can just ease them back into the wheelchair.
and I'll go ahead and summarize real quick with the nursing care plan. So we're here to talk about some goals to increase the activity tolerance, keep them from having any complications from impaired skin integrity, and keep their self-esteem, so they can keep them bathed, clean. They can't really do it themselves. Could be clean, helps with self-esteem. And also some teaching. Teach them to control blood pressure. Stop smoking if you're doing it because it's going to have, if they're on oxygen, they're not going to be smoking because they don't need to blow up. And eat a healthy diet. That one's pretty important. And then exercise. And that's, pretty much all done. So that would be the conclusion.